Hello and welcome to episode 27 of On Liberty, coming to you live from the Center for Independent Studies in Sydney, Australia. I'm your host, Salvatore Babones, and joining me today is Dr. Carlos de Brera. Dr. Brera works on the front lines of public hospital care and community mental health here in Australia. I'll be talking to Carlos about the psychology of fear and the complicity of the public health system in further isolating some of the most vulnerable people in our community. Dr. Carlos de Brera, how are you?
Very well. Thank you, Salvatore, and thanks for having me on.
Oh, no, thanks for joining us. You're much busier than I am, that's for sure. Look, I was reading recently that the staff at the ABC declined to take a pay freeze to help out the ABC during the coronavirus crisis. And of course, more power to them. I work at a university. I have a secure job. There are people like me and ABC reporters who simply have had a good coronavirus, right? Our pay hasn't been hit at all. We've accumulated savings. But public health orders certainly have harmed many other people. Do you think they've maybe aided the few and not the many?
Yes, look, I think there's been a disproportionate impact of the coronavirus and more importantly, the coronavirus lockdown in our society, and I think probably across all Western societies, not just our own. And yes, you're right. I think in universities and in government, and certainly in public health, our salaries are pretty much guaranteed and underwritten by the taxpayer. But certainly there are vast swathes of people who are suffering financial hardship as a result of the consequences of the lockdown and find themselves unemployed and at home and possibly facing indebtedness and difficulties making mortgage payments. And I think there will be a lag, but at some point, when the rubber meets the road, there is going to be a widespread catastrophe, public health catastrophe, with psychiatric symptoms as one of the core features of this catastrophe.
Right. Now, I know psychiatry is your own specialization. Uh, what does it mean when people lose their jobs? I mean, even if they have job keeper and job seeker allowances, is that it? Like, are they fine because they have a little bit of income streaming in?
Well, that's an interesting question. I mean, I think in society, there's certainly a proportion of people who, in the short term, would rather be paid to stay at home than to work. So there are powerful disincentives to employment for a proportion of people in our population in the short term. I think in the medium to long term, the consequences for the individual and for society of not working cannot be understated. I think work provides people with structure and routine and the ability to mix with others. It gives them respite from the home, particularly if they've got a difficult domestic environment. But I think once you withdraw that, you end up with a whole lot of consequences, which ultimately I think will have psychiatric effects. I think you'll see increases in alcoholism, increases in domestic violence, increases in obesity, increases in smoking, and a whole range of sort of unintended consequences of the lockdown. So I think the job keeper and job seeker payments are a kind of kicking the can down the road a little bit with this pandemic response. And once those financial platforms are removed, I think there'll be a catastrophic collapse, both economically and also in terms of people's mental health. So the short answer is yes, I think employment is very important for people. It's important for people's self-esteem. It's important for their self-worth. And once you remove that, what are people left with? Well, not a lot.
Mm. Oh, look, we've seen reports from England, especially, of people no longer being willing to comply with coronavirus public health orders if they feel they're ridiculous, if they feel that they're just not well targeted. Now, even in England, which has had a very serious pandemic experience, people are kind of having lockdown fatigue.
Mm-hmm.
What about here in Australia, where, let's face it, I mean, the numbers of coronavirus cases are extremely low?
Mm. So I think I probably, at the start of this pandemic, overestimated the prospect of early lockdown fatigue, and I've been quite amazed by the degree of patience and the degree of goodwill shown by Victorians, particularly in the face of these very prolonged and onerous lockdown restrictions. But I do think that even Victorians will have limits to their patience.
Mm-hmm.
And I read this morning in the Australian that the prospect of a third lockdown by Daniel Andrews will be the straw that breaks the camel's back. And I think there's probably some truth to that. That as human beings, there are limits to our abilities to withstand long-term social isolation and the complete disruption of social bonds and social activities, and even the ostensibly harmless act of wearing a mask in the long term, I think will end up wearing people's patience, and they'll, I think, end up refusing to comply with that restriction.
Right.
So, yes, I think there are limits to the ability for human beings to withstand these strictures. And you're right to say that particularly when they're ridiculous or don't make medical sense, I think the government is playing very dangerous games here, because if they compel us to do things which are obviously ridiculous, like wearing a mask if you're out by yourself in the countryside, then they're going to have lot of difficulties, a lot of difficulty asking us to do things that might have an evidence base to them. So it's not a very smart tactic, in my view, to force the populace to do things that they know are ridiculous.
Yeah, that's a really interesting point, because I think most of us are very happy to do our part if something's meaningful. So every restaurant I go to has a QR code to
Yeah.
scan in, and of course I scan in. They ask me to scan in. What's the
Mm.
problem? It seems reasonable enough. People are happy to sanitize their hands,
Mm.
especially if they walk into a hospital or a public building.
Mm.
It's those seemingly meaningless restrictions
Mm.
that seem to erode public confidence. Do you think that public confidence in government will decline? I mean, after all, in Victoria, it seems like public confidence in government's at record levels,
Yeah.
despite the mismanagement in Victoria.
Yeah, so I think that speaks to a different psychological phenomenon, which I've talked about, which is the sort of Stockholm syndrome effect, that some people at least, tend to perversely fall in love with their captors. And Andrews has done a very good job of being the hard man of politics and the hard man of the lockdown, extending as far as the black mask that he wears. You'll probably notice he doesn't tend to change the color of that mask. It's very dominant and very kind of morbid. And I think people like the idea of having a strong leader, even if that strong leader's policies are ultimately harmful and counterproductive. So I think there is a degree of that in Victoria, although I note that his popularity has been slipping from sort of, I think, popularity of in excess of 80% now down to, I think, 60 or thereabouts in a recent poll. So I think even amongst the true believers in Victoria, he's beginning to lose popularity as fatigue sets in. But this, just back to the notion of making people do ridiculous things. Well, that's quite clever, I think, in some ways, even though it's a dangerous game, as I alluded to before, because if you can compel someone to do something which they know to be ridiculous, then um, that's a very impressive way to demoralize a population. And without wanting to get all conspiratorial about things, I think that there is an element of masochism and of demoralization of the population that's going on in Victoria. If you look at the police crackdowns on quite ostensibly benign Facebook posts in Victoria. This is a population that is now living in fear, I think. So he's a very clever manipulator, is Dan Andrews, and whether he's doing it deliberately or has an instinct for it, what he's doing is very effective. I don't think it's going to be an indefinite thing, and I think he'll come a cropper at some point, but it's very effective at the moment.
Well, I won't ask you for a pop diagnosis of Dan Andrews at a distance, but I will
No,
ask you to talk about your actual work there, because you're working in Melbourne, is that right?
no, I live and work in Sydney.
Oh, you're in Sydney. I'm sorry. I thought you were in Victoria.
I'm from Melbourne, and I have
Okay.
family
But
in Melbourne. But
but even
yeah,
here in Sydney, of course, you have a real, you know, forgive the analogy, finger on the pulse
yeah,
of our health system, and
yeah,
you see things that the statistics won't tell us for a couple of years.
yeah.
Have these sudden episodes of isolation where people have been pulled out of their social networks, has that led to a spike in suicide cases, or at least attempted suicides that you've seen? Or are more people needing health care as a
Yeah.
result? And are they getting it?
So that's an interesting question, and I think we're only just beginning to get some data on it. I work in a hospital where the majority of patients are long-term patients with chronic and severe mental illnesses. I think where we are seeing a spike in demand for mental health services is in the world of general practice predominantly, and probably to a lesser degree in community mental health clinics. Now, I don't work in any of those settings, but I have heard anecdotal reports from colleagues who do that there has been a marked spike in depression, anxiety, deliberate self harm, drug and alcohol abuse, domestic violence, and just a general increase in I guess, a general reduction, I guess, in mental well-being for people who didn't have any pre-existing conditions or disorders, and an exacerbation of conditions in people who do have pre-existing disorders, so depression, anxiety, OCD, certainly the fear that has been whipped up by the media about the contagion of this virus has certainly led to an increase in suffering for people who have obsessive compulsive disorders, because all we hear about in the media is how this virus is everywhere and it's on surfaces and it's in the air. And so, yes, we are seeing an spike in mental health problems, and I think that there will be a lag before there is a spike in severe mental health problems secondary to the economic effects of the lockdown. I do think, like after the Great Depression, we will see record levels of suicide in this country. I think that's inevitable. I don't see how that can't be the case.
Well, we've had actually, it seems like we've had a deterioration in the link and some poor sound quality. We'll see if the producer can fix that, or if there's anything we can do about it. Let me take a moment just to say hello to our viewers, Anthony, Emily, Gay, Courtney. Thanks for tuning in live. We really appreciate it. Carlos, there's one related question I'd like to ask you, which is about the ability to access healthcare. We've heard a lot of stories of people not getting cancer treatment or not getting
Yeah,
heart treatment because hospitals have been no-go zones. Is
yeah.
that also affecting people with serious mental illnesses like schizophrenia and bipolar disorder? Have they been unable at times to access healthcare because of hospital restrictions?
Um, Look, I don't know. I mean, from my observations in the public health system in New South Wales, during the height of the early stage of this pandemic, the number of presentations to the emergency departments for mental health problems dropped off significantly.
Mm.
And opposite to what you might expect, we had vacancies in our hospital for psychiatric beds.
Right.
And I think there are possibly a number of reasons for that. It might have been the case that such was the panic and worry in society that people who might have had a lower threshold for seeking help increased that threshold and just sort of managed at home.
Right.
Look, in Australia, the vast majority of psychiatric services are community-based services rather than inpatient services. And certainly it is the case that during the pandemic, it became more difficult for community services to function effectively and to see people in their homes because of the restrictions put on travel and social distancing and so on and so forth. In response to this, the government and the College of Psychiatrists expanded the use of telehealth assessments and telehealth treatments for people with mental illness. Now, that's all well and good for people like you or me, as you opened this conversation with, but for people who have perhaps limited access to information technology and to the internet and to laptops, these people are likely to go without necessary treatments. So there are limits to what telehealth can achieve in dealing with people who have perhaps more severe and enduring mental illnesses.
Right. Now, Dr. Barra, people who want to find your work can just Google Spectator Carlos de Brera. They'll find your column there. I know you do a lot of public writing, so people please look out for that. But you've also written for the Center for Independent Studies, and I'd like to feature this report that you authored. I think it's a couple of years ago now. It is Dying with Their Rights On, the Myths and Realities of Ending Homelessness in Australia. We've had a lot of talk this year about how easy it was to end homelessness, that once it became a government priority in March, April, homelessness was just taken care of. Is that feel-good story true? Have we seen the disappearance of homelessness in Australia?
It's a very good question again. Look, certainly walking around the streets of Sydney, it appears that there are fewer homeless people on the streets. I mean, certainly in the early stages of this pandemic, there were virtually no homeless people in the CBD of Sydney that I could see. I think we're seeing numbers of people sleeping rough on the street corners increase as the lockdown restrictions have lessened in New South Wales, and I think we'll probably have a return to the status quo at some point. But yes, it was remarkable how quickly people who'd been sleeping rough for years were able to access a roof over their head at relatively short notice when the government was keen to have people off the streets. And look, certainly there is some evidence that the homeless population, there was a Lancet article came out about a week ago in the UK, the homeless population are more vulnerable to COVID infections and are more likely to have comorbidities. So, it's certainly the right thing to do to address the needs of homeless people in the face of this pandemic. But yes, you're quite right. It also, the speed with which housing was found for these people sort of really, I think, highlighted the lack of will perhaps that government has had prior to the pandemic in housing people who have homeless people who have mental illness.
Well, I know a lot of the stories were these puff pieces about, from the streets of King's Cross to a five-star hotel. But clearly, five-star hotels are not going to be used as a long-term solution to the homelessness situation. And in your own work, I found it very interesting. You distinguished between sleeping rough and the homeless numbers that are peddled kind of by the homelessness industry, which is much more focused on solving the problems, it seems, of people who have an inadequate home instead of the much more difficult problems of often mentally ill people sleeping on the streets. What's going to happen to that core, serious problem group, the mentally ill who are sleeping rough? They're not going to stay in the five-star hotels. Where are they going to go once the pension passes?
Well, I suspect they'll end up back on the streets, Salvatore, and we will revert to policies, the failed policies that have kept them on the streets. And those failed policies are a reluctance to manage them assertively and to manage their mental illnesses and their drug and alcohol dependence problems. Where we will see So that's the rough sleeping population, which I think will probably remain relatively unchanged. That said, there is the larger population who will be at risk of unstable accommodation once the economic catastrophe of the lockdown takes a grip. I think we will see people who previously had secure accommodation face the prospect of eviction and of perhaps more transient accommodation and maybe even sleeping rough. But we'll see once unemployment hits a certain level and once JobKeeper and JobSeeker disappear and once the economic Armageddon hits us, I think we will see an increase in homelessness. How much of that will be rough sleeping? I'm not sure.
Right. Now, Dr. Brer, I have to apologize. This is the moment when I ambush you, but our viewers will be well aware that this is the moment when I ask them for money. We'd like to have as members. For $40, you can join CIS. I'd really appreciate it if any of you who join now during the program so that it can be explicitly linked to the success of this program and reaching out to people around Australia and around the world. You don't have to be an Australian to join the Center for Independent Studies. If you're already a member, you can upgrade from the $40 membership level to the $250 membership level. And if you do, I will personally send you a signed copy of Liberty and Liberalism, the first work of classical liberalism published in Australia by Bruce Smith. Now, this is not the original edition. This is a reprint put together by the Center for Independent Studies under the leadership of Greg Lindsay. I'd love to send you a copy. I have a copy. I have actually mailed out 4 or 5 copies of this book to people who contributed at the $250 level. Of course, please just thumbs up the video. We often lazy about liking videos, but honestly, if you want more people to see Dr. Debrera talking, if you like the video, the YouTube algorithm will feed it to more people, and we'd love to get the word out about that. Dr. Debrera, thank you for being patient while I make a pitch. I really appreciate it. We have some questions. First, let me go to Anthony. Anthony asks, has anyone done a cost-benefit analysis of the measures taken to combat the pandemic? Is someone working on this?
Yes. So I found one this morning undertaken in the United States, and I don't have the reference in front of me, sadly. I should have printed it out. Looking at the cost-benefit analysis of comparing a complete lockdown to a partial lockdown to a no lockdown at all.
Right.
And interestingly, that was a study undertaken looking at a US population where, of course, they've had more coronavirus deaths per capita than we have had in Australia. And even those researchers, and these researchers are generally quite left-leaning in their political views, concluded that the cost of a complete lockdown, or what they call shelter in place in the US, would only be worthwhile if there were hundreds of thousands of deaths more than we're actually seeing at the moment. So they argued for a partial lockdown in terms of cost-benefit analysis. Julian Savulescu, who people might know, famous Oxford-based ethicist, and traditionally someone who has been a friend of the left, published an opinion piece in the Conversation just on the 17th of this month, arguing that in terms of cost-benefit analysis, the lockdowns that we're seeing in Australia are a sledgehammer. That was his quote, and probably cannot be justified in terms of quality of life year analysis or other cost-benefit analyses. So there are researchers arguing now, which is good to see, that maybe the sledgehammer effect of a complete lockdown can't be justified in terms of cost-benefit analysis.
Right. Gay suggests that we should be in regular contact with our friends, especially Victorians, including them in things we do virtually. In her words, tears, fears, and laughter. Does virtual inclusion, does reaching out to your friends and loved ones via, Zoom or Skype or WhatsApp, does that FaceTime, does that help them psychologically, or
Yes,
really do you need in-person contact to make a difference?
in-person contact is obviously better because it is something that occurs across a range of sense domains, not just auditory, and I guess visual with
Right.
Zoom. But nothing can replace that. But of course, this is a second best. And we should, of course, communicate with people as often as we can who are in isolation.
Right.
Sadly, a lot of people who are in isolation don't have the capacity to communicate with others, even virtually. You think of some very elderly people who perhaps are unable to use Zoom or social media, who are kind of languishing by themselves with very little in the way of support in Victoria. There must be tens of thousands of these people. And what happens to the quality of their lives?
Mm.
And why are politicians not more interested in the quality of their lives?
Right. Cameron wants to ask if COVID-19 is going to be with us indefinitely, should the recording and reporting of statistics be reset seasonally? So we think of flu seasons and we give numbers for
Mm,
flu seasons. Well, for COVID, there's just a kind of running tally, which gets
yeah,
worse and worse and worse. If we accumulated all the flu cases for the last 50 or 100 years, we'd
yeah,
have an awful lot, a big tally of
yeah.
flu.
Look, absolutely. I agree with that, and this raises the very interesting point that I was going to talk about, um, relating to the way that the media and the government report these statistics.
Right.
Um, and very briefly, without going into detail, there is a phenomenon that has been recognised for about 20 years or so, and that has been recently reported in our College of Psychiatry in Australia, wherein people disproportionately pay attention to negative aspects of news reporting rather than to the positives.
Right.
The government and the media have done a very, very good job of manipulating this cognitive bias that we have of disproportionately attaching significance to negative outcomes rather than to positives. So when Dan Andrews gets up every day and does his black masked sort of roll call of the people who have died, he is reinforcing in people's minds that this is a very, very dangerous virus, and then this kind of very pessimistic worldview is spread through social media contagion. And it's no surprise, therefore, that people overestimate the risks of contracting this virus or the risks of dying from it. And I think the government and the media are quite happy for this overestimation to persist because it allows them to continue the measures that they have undertaken, the disproportionate measures, in my view, to reduce our abilities to earn an income and to communicate with others and to live a normal life. So this idea of negativity bias and of negativity dominance and social contagion is very, very powerful. So yes, we should be recording things in an honest way, but not in a way that catastrophizes the situation.
Right, right. Actually, I teach an undergraduate quantitative methods class, and I've devoted the entire class this year
Mm,
to focusing on coronavirus statistics,
yeah,
how
yeah.
they're used. And I'm certainly with you on that. That there's a lot of
Mm,
misuse going on. Look, Emily Jane would like to ask. Says doctors in Melbourne have written a plea to Dan
mm,
Andrews because they're worried about the mental health concerns the lockdown is causing.
yeah.
What restrictions would you recommend be lifted, or any at all?
Uh, well, I would recommend that restrictions that have no scientific evidence base to support them be lifted immediately.
Right.
Um, and obviously, the curfew has gone. That seemed to me a complete waste of time. I would lift travel restrictions. I would lift restrictions on dining in public and on social gatherings. And as we've proven in New South Wales, it is possible to lift those restrictions, but to still keep the spread of the virus at bay. We've got a very good A-B comparison between Victoria and New South Wales. roughly equivalent populations and roughly equivalent demographics, yet we're managing to live with the virus here with far fewer restrictions than we have in Victoria currently.
Mhm.
So I'd reduce most of these restrictions and sort of really adopt an approach that prioritises individual responsibility, as they've done in Sweden,
Right.
and perhaps to a lesser degree in Korea and Singapore, and just get on with our lives, managing to live with this virus, because who knows how long it's going to be with us.
Right.
And if it is seasonal, are we going to see a recrudescence of the infection every winter? And is a vaccine going to come in the near future? Probably not. So we're going to have to live with it, whether we like it or not.
Hey, Vladimir Putin already has a vaccine, and Donald Trump will have one by November 3rd. So watch what you
I've
say.
heard. Congratulations.
But
It's
let me
reassuring.
pick up on that issue of individual responsibility. The
Mm,
CIS, of course, thinks of itself as a classical liberal think tank. We're, after all,
yeah.
peddling liberty and liberalism here. The show is
Mm,
called On Liberty, and part of that is the idea that people should take responsibility for their own lives and
yeah.
specifically for their own health. Now, I
Mm,
think there was a widespread popular demand for government to do something in
mm-hmm,
February and in March to keep
mm,
countries safe. Government spectacularly failed in February
mm,
and March to keep their population safe. But
yeah.
now, shouldn't we be seeing a shift from the government has to do something to, okay, we've got the basics down. Now
Mm.
let's shift to individuals taking responsibility.
Yes, we should. Whether we will or not, I'm not so sure about. Um, there is a phenomenon wherein complex problems are best solved at a local level rather than at a central level in the sort of hierarchy. And this is indeed a complex problem, um, and uh, and it has been shown, I think, in Sweden at least, that solving this at a local level is optimal. And of course, the most local you can get is individual.
Mhm.
And I think we're well and truly now up to speed with hand washing and keeping distant from one another and staying at home when sick. Um, and I think it's time that the population be trusted to do
Right.
these things, to stay at home if they've got a flu-like illness and so on and so forth, without having to beat them over the head with rules and regulations indefinitely, which I think ultimately will be counterproductive. So yes, I would love to see a shift away from government diktat towards individual responsibility. Interestingly, the one demographic that in Victoria who are very keen for these restrictions to end are the elderly, people over 65,
Mm.
who potentially have the most to lose from a lessening of restrictions, but who would like to
Right.
have quality of life rather than longevity necessarily.
Right.
Although, of course, these things aren't mutually exclusive. If people don't have quality of life, they're probably less likely to live long anyway.
Mhm.
So I think that all these calls to protect the elderly at all cost need to be taken with a grain of salt, because it's the elderly who are most disadvantaged by these lockdown measures.
Right. And these rules are ironically paternalistic.
Absolutely, yeah,
Ironically, because it's us
yeah,
being paternalistic towards our own parents.
yeah.
Uh, look, Anthony's curious of your view on contact tracing. He's
Mm,
wondering, what do you think? How good is our contact tracing system? How
mm,
does it rank with other systems? Are
mm.
other countries like Singapore doing this better? Do you have any feel for that, the success of contact tracing in Australia?
No, I don't, and that's really outside of my of
Okay.
my uh, of my expertise to
Right.
comment on.
Well,
Um,
I will point people to my foreign policy article about COVID safe,
right, good, good.
which
Well,
we
I
don't
mean,
hear about these days.
we don't. It sort of disappeared, didn't it? Really, everybody downloaded it. I didn't, but other people did, and that sort of disappeared a little bit. I think if you ask Gladys Berejiklian, she'd tell you that contact tracing is fantastic in New South Wales. It's probably less effective in Victoria. But I don't have a firm opinion one way or another as to whether or not it's a good thing or whether we should have more or less of it. What we should have is less panic, I think, and a greater sense of proportion, and perhaps an acceptance that this virus is, for the most part, either asymptomatic or relatively mild in terms of its symptoms, and we need to take that into account when formulating public policy. And Alan Jones is right. He says on TV that the government needs to have an honest conversation with the population about the dangers of this virus and how they've been exaggerated. And I've not heard a politician really talk sensibly about the risks of this pandemic. They all, whether Liberal or Labor, want to exaggerate the risks without having an honest conversation with the population. And as I said, it's very hard to undo panic and to undo fear because we tend to attach greater significance to negative consequences rather than to positive ones.
Now, Australia, of course, is a federal system. Are there
Mm.
states and territories that are doing it well? I mean, is there anyone you would hold up as an exemplar of public communication or
Mm.
appropriate taking an appropriate approach here?
Well, I mean, the best of the bad bunch is probably New South Wales, from what I've read. It's hard to comment on other states because we're not allowed to go there, and of course, it's difficult to know really what's going on in individual states in regards to the response. I'm not a fan of border closures, and I think the evidence behind them in terms of spread of illness is very, very limited. And I know that the federal government health advice at the start of this pandemic was that border closures were not necessary, and it was the individual states that made those decisions. I look at West Australia, for example, which is basically now virtually seceded from the rest of the country. And they've had, I think, 0 cases. But what happens when they open up and they have their first case?
Right.
I think that's almost inevitable, as we've seen in New Zealand, which had a very hard initial lockdown. So I don't know. I think this. I think in some ways this has tested federalism and has probably led to an ugly parochialism in some ways. Victoria, Queensland, and West Australia probably being the worst offenders, perhaps Tasmania as well. And I think Gladys is probably doing a good job of balancing sensible antiviral measures with optimizing people's individual liberties and business prosperity.
Now, we're going to be wrapping up in just a minute or two, but we
Yeah.
do have some final questions. I have one from Stephen and one from myself. Stephen asks, how do we support people with mental illness who perhaps can't themselves do social distancing or personal hygiene very well?
So I have this problem at my workplace because I struggle to get my patients to wear shoes or to shower regularly because they have very severe mental health problems. So wearing a mask for many of them is an impossibility.
Right.
And it's a very, very difficult thing to impose. Now, that's assuming that you think that a healthy individual wearing a mask is a good thing. I tend to think that it isn't. So, look, you do your best with that population, just as you would with perhaps people who had Alzheimer's dementia or people who had other sort of cognitive problems. You do your best to look after them, and you do your best to try and limit the spread of infection in institutional settings. But I think that again, even for people with severe mental illness, the costs of these measures probably outweigh the benefits.
Right.
And certainly my patients have had very severe restrictions on their individual liberties in terms of their ability to go shopping, for example, or to have leave with family or carers because of the lockdown restrictions. And these patients often don't have a voice and have little in the way of sort of public advocacy.
Right.
And aren't likely to complain. So much as I'd like to see my patients not get sick from coronavirus, I'd also like to see them not have to live even more restrictive lives than they already lead.
Right, right. So let me ask you a final question. When
Yeah,
this is all over,
yeah.
whether it's next year or 2022 or 2023, whenever it is, if you had to guess, are you going to guess that in Australia, more people have died of coronavirus or
Mm.
more people have died of government policies put in place to address the coronavirus?
Mm. Oh, golly. That's that's
It's an
putting me on the
unfair
spot.
question,
It is a little bit.
but I'm
Uh,
curious your thoughts on it. Even if you can't answer the question, you can think about the
let me answer
consequences.
it. Let me answer it this way. If it turns out in 5 years, if we could invent a time machine and travel
Right.
5 years into the future, and it turns out that the number of deaths or the number of shortened lives, let's say,
Right.
caused by these lockdown measures and the ensuing economic catastrophe exceed the numbers of people who died of coronavirus, um, I would not be surprised.
All right.
That's all I will say. And I will say that even if we don't have to consider deaths, if we consider morbidity from other medical conditions or suffering, I think we'll see that far exceed the amount of suffering caused directly by the virus.
Right. Dr. Carlos Dobrera, thank you very much for joining us today.
Thank you, Salvatore, for having me.
Next week, we'll be back at the usual 10 a.m. slot. I won't be here, but we'll have a guest host with Simon Cowan speaking to our Senior Research Director, Robert Carling. The producer of On Liberty is Emily Holmes, executive producer Max Hawk Weaver, the director of CIS is Tom Switzer. I'm Salvatore Babones. Thank you, everyone, for joining us today, and I'll be watching next week. I hope you'll be watching too.